As just about everyone knows, there are a lot of issues with the U.S. healthcare system. It's expensive, it's complicated, and when it comes to the best of the best nonprofit providers, like many here in Boston, you'd like to think they're focusing all their attention on their patients coming to them for care. Or if they're splitting their focus, it's for good reason. But as a new Boston Globe Spotlight investigation found, in at least one instance, that wasn't the case. The Globe report details how Brigham Health partnered with a Chinese conglomerate in 2013 to build a hospital in China where very wealthy patients would pay top dollar out of pocket for high quality care. But in the end, despite nearly 400 faculty and staff from Brigham and Dana-Farber getting involved, with around 220 plus hour trips from here to China, the final hospital attracted almost no patients at all. So this past June, Brigham's contract with its overseas partner expired. It quietly scrubbed the hospital from its webpage, touting international projects. And the name of that Chinese partner, by the way, you'll likely recognize it, as you'll find out in a minute, but not for anything good. Now, as the Globe article states, few from Brigham Health are eager to talk about it. And in fact, among those who refused to speak to reporters about any of this, Dr. Elizabeth Nabel, Brigham Health's then president. Mark Davis, the former executive who led the company's international collaborations at the time. Lisa Morrissey, the former interim chief nursing officer who worked on nursing plans and training for the hospital. And several clinicians involved in the venture who apparently needed officials' approval. But for now, I'm joined by a couple of people who are willing to speak on the subject. Boston Globe reporters Deirdre Fernandes and Rebecca Ostriker, who worked on the story along with Liz Kowalczyk and Spotlight editor Patricia Wen. Congratulations to both of you, and good to see you.
Thank you. Glad to be here.
Rebecca, these numbers are staggering to me. It took a year for the first cancer patient to appear, and when a Globe correspondent went over to see how many of the 647 beds were filled, how many were?
Well, we heard from multiple sources that in this gigantic hospital, 647 beds, there were typically no more than 10 patients at any time. And that was over the span of the entire contract. As you mentioned, it took nearly a year for them to get up and running. And then after that, it was very slow word of mouth, getting a little bit more, but still, as we were told, not enough to sustain the hospital by any means.
Deirdre, I know people should read the whole thing, but in a nutshell, why did it fail so miserably?
Well, I think the location was the biggest issue. It's in this island province of Hainan, and it's basically this very southernmost tip of China. The people in Hainan make about $13,000 annually, and this hospital was built essentially for wealthy patients, and it was geared towards people who would fly from mainland China or Vietnam or around Asia to get hot care at this hospital that with the Brigham kind of training and brand on it. And in the end, nobody really came. It was hard to get to. It was located in this kind of very isolated town on the island, and people didn't show up. I mean, if some people mentioned, if you're about to get cancer care, do you want to travel by plane and then have to take a car or a train to get to the hospital?
At the time, Deirdre, staying with you, the company that I hinted at a minute ago is Evergrande, which is in the news carrying a mere $300 billion in debt, a real estate development firm over there in real trouble. Was there any indication that this company that Brigham was partnering with as far back as the beginning was a risky venture, Deirdre? Should the Brigham have known?
Well, I think the Brigham, there was indication that there were people, investors and investment people suggesting that this company, Evergrande, was using creative accounting techniques. The company actually went into lots of different things. They went into bottled water, they bought a soccer team. There was a lot of kind of buzz around it, but also these questions about how much of it was real and how much could they really sustain it. And as one investment expert kind of said, this was kind of a Ponzi scheme. They were, doing a lot. All their ventures were just a way to raise more and more money. So there was a question.
Rebecca,
Brigham said that they. Oh, sorry.
No, you go ahead.
I was going to say, Brigham said that they vetted the company and did some financial vetting, and they also had an outside group look at this project and this, but they wouldn't say who the outside group was or this outside firm was, and they wouldn't kind of go into much detail about what kind of vetting was done.
Rebecca, you mentioned in your piece that you and your colleagues do that MGH has a joint venture in China as well that is going well. So is the point here and the focus on the Brigham that it failed, or who it intended to provide services for? Why the focus on them?
It's a great question. I mean, both things are good questions. There are people who are questioning whether large nonprofit hospitals should be doing this kind of thing at all. Should large nonprofit hospitals be going overseas to try to help cater to wealthy people abroad if their basic mission is here at home? Both hospitals did that. One hospital opened, MGH partnered with some folks and opened a hospital in Shanghai, which is a gigantic city of more than 26 million people. That hospital is doing much better. It's located in a busy part of the city.
Sure.
There's a lot of expatriates and wealthy folks there. And if you need treatment and you're already in Shanghai, that's where you might go. I spoke with someone from Deloitte who pointed out that the feeling in that hospital is very reminiscent of what you might experience in an American hospital. But the choice that Brigham made to partner with this gigantic real estate developer who had no experience at all in healthcare, and to put it on this. Yeah, on an island which was difficult to get to. It's embarrassing that it was a terrible failure, but there do remain questions about, just in general, whether nonprofits should be going into this.
Can we stay on that question for a second? For those who don't, to translate, nonprofit means tax exempt. And a nonprofit institution in any jurisdiction means that those of us who pay taxes make up for those who don't pay taxes. And they have chosen, in part, to their nonprofit mission to serve billionaires or attempt to serve billionaires. You combine this with an earlier spotlight story in your paper about the heads of teaching hospitals, including the same woman who led this venture, Dr. Nabel, who was on a couple of corporate boards, sold her Moderna stock for $8 million. Is there anybody, Rebecca, in the hierarchy of the Brigham that is concerned at least about the appearance of what this hospital and its leaders are doing as a nonprofit entity?
Nobody that we spoke with seemed to be concerned about it. And you raise a very good point. I mean, this is something that the Spotlight team, our colleagues, have been looking at with other stories. And you mentioned the one, something like 6 out of 7 of Boston's hospital chiefs taking on lucrative positions on corporate boards, more common in Boston with all of our wonderful hospitals than in any other major U.S. city. There was an earlier story about ethically questionable investments by Dana-Farber trustees. So there are real questions to be raised in around this. And when it comes to Brigham, no, there was as you mentioned, all the people who didn't want to talk with us. We did manage to speak with one Mass General Brigham executive about the Evergrande project briefly. But he made it clear that he had only been with Mass General Brigham since 2020, and he hadn't been involved in the development of this project, and there were a number of things that he wasn't aware of. So, they say that this is part of their efforts to improve global health. They say that the corporate ventures abroad are help support the work that they do in the local community. The problem with that
but can I stop it? Yeah, go ahead. I'm sorry.
No, go ahead. Please jump in.
You're going to mention work in the local community. You guys list the Lown Hospital Index ranks them I can put it up here, of 3,641 hospitals nationwide. Community benefits, things like charitable spending, community investment, Medicaid revenue is a share of patient revenue. Near the bottom, 3,188. So we're running out of time, but essentially, Deirdre, can you give me 30 seconds on, has there been a response from legislators other leaders who you didn't interview indicating some concern? Or is this just another day at the office? Quickly, if you can.
Well, I think that's the issue, right? Like, who's watching these hospitals and whether or not they're, living up to their nonprofit kind of status. And that's an open question. And that we haven't, there's been a lot of outcry from the public. But the question is, what are legislators and the lawmakers going to do about it?
Well, we'll ask them if we can, and we hope you do too. Congratulations to you and your colleagues for yet another great piece of work. I appreciate your time.
Thank you so much.